Hello everyone, nice to see you in this video. We are going to discuss today about records part 2. So this is me, Jansi Mary, working as a tutor at Tripoli College of Nursing. So let's dive into the topic. Objective for today's topic is at the end of the session, the listeners will be able to apply the methods, formats and modern approaches of nursing documentation. Definition. Documentation is the process of systematically recording everything related to the patient care. So recording nursing care and patient observations, as well as it ensures continuity and the quality of care which is provided. Okay, what are the purposes? Purposes includes accurate information of the patient, facilitate communication, maintain legal record, evaluate nursing care and assist in research, and also audits. So documentation ensures that all the nurses and healthcare providers have access to do the same information. What are principles? Principles. These principles ensures records are reliable, useful, and very legally safe. So the principles are accuracy. It is accurate. So it records facts only, not myths. Completeness, which include all the relevant data which is collected from the patient. Timeline, document immediately whatever is done for the patient or whatever the patient had episodes of. And confidentiality, it protects patient's privacy. And legibility, clear handwriting and or the electronic entry. So that is legible. These are the principles. Okay, what are the methods? The methods include narrative notes, that is written description of the events what had taken place. Next is the SOAP format, which includes subjective, objective, assessment and plan format. Next is the PI format, where problem, intervention and evaluation is included. And focus charting focuses on the patient problems or goals. Electronic health record includes, or EHR includes, the digital documentation. So SOAP format organizes information and it is easy to follow for the evaluation of the patient care. We'll see what it is in detail. Narrative notes. So narrative simply tells a story. Narrative writing is nothing but tell a story in a chronological order. Okay, so it comes as a chronological order, descriptive form, and details patient care response. So they provide detailed information about the patient care, but cannot be, notes are very simple, but sometimes it can be lengthy as well. That is about the narrative notes. Moving on to the SOAP format, as I already told you, SOAP, S stands for subjective, where patient complaints comes there. O stands for objective, where observation and vital parameters, what you had checked for the patient, comes under that criteria. A stands for assessment, where nurses interpretation, and P is plan, what nursing interventions are. So SOAP format simply organizes information and is easy to follow for patient care evaluation. Next, it is PI note. PI, okay, PI means problem intervention evaluation format. Problem, for example, outlines the client's presenting concerns. Example, a 35-year-old female presents with symptoms of generalized anxiety disorder. That is a problem. Intervention, a specific therapeutic technique. What are we doing? CBT technique was introduced. That is an example of intervention what we did for the above said symptom. Then evaluation, client's response to the intervention. So example, a noticeable reduction in anxiety levels. Okay, so this is the PI format. Next is electronic documentation. Electronic documentation is nothing but a digital record of the patient care accessible to all the healthcare providers anytime inside the hospital premises, reduces the errors and facilitates audits. So it improves the accuracy, accessibility, and efficacy. So many hospitals now use this EHR system. Next is legal and ethical or document. So nurses are legally responsible for the documentation purpose. Any falsification can lead to disciplinary or the legal action. So always remember, document truthfully, protect patient confidentiality, never falsify or omit any information regarding to the patient, whatever events had taken place, and follow the hospital policies. Moving on to the next, nursing responsibility. What is nursing responsibility? Maintain accurate records, update the care plans, report the changes in the condition of the patient, ensure legibility and timelines, educate patients when required. So nurses play a very key role in maintaining quality and integrity of the documentation. To conclude, proper documentation ensures safety, continuity, and professional accountability in the patient care. So documentation ensures the quality care as a whole, and it also uses standard methods. Standard methods include SOAP, PI, and EHR format, and also it maintains a legal and ethical standards, supports communication and audits. It outstands for the communication and audit purposes. Hope you understood the topic. Here we are concluding with the records part 2. Thank you.